My name is Adam.
How old are you?
10 years old.
You go to school?
Yeah.
You go to school?
Yes.
In 2008, Adam Ali began experiencing pain in his knees. After countless misdiagnoses, an MRI revealed a rare spinal cord tumor that was compressing nerves to his legs.
I mean, hearing the word tumor itself, it sends shivers in anyone's, spine, for the matter of fact.
Adam and his father traveled to Singapore for a second opinion when Adam began experiencing shortness of breath. The doctors there advised he undergo immediate surgery due to the tumor growing and compressing nerves to his lungs. By age 9, Adam had undergone 2 surgeries and a round of chemotherapy, all of which only reduced the tumor by 10%.
At that point, I think the family lost hope and just said, okay, we're gonna have to live with this. Eventually this tumor is gonna grow or may become malignant. But Dad just had access to the internet, reached out.
He replied to my email within 24 hours. Because when I was emailing to other doctors, there was a delay in time, right? Some didn't reply, but Dr. Jallow replied to me within 24 hours. I remember that was my first email.
I looked at the films, I discussed it with our team here, as well as I discussed it with his doctors in Malaysia, and I said, you know, I still suspect it's a low-grade tumor, and I think given the technology that we have here, we'll be able to remove a large portion of it and theoretically be able to treat this tumor completely.
And then I asked him how much you could remove. Naturally, that would be my first question, you know, how much he could remove. And he confidently said, I can remove more than 90% of the tumor. Then I go again, asked him, what about the risk of paralysis? He said, 90% removal with minimal risk of paralysis.
When families ask me about what the condition is, what the prognosis is, what's going to happen, I can confidently tell them what I think is going to. In the usual scenario, this is what's going to happen. This will happen at surgery. This will happen immediately after surgery. This will happen, you know, when we get the MRI. This is what we should see, and then his recovery or their recovery will be this, this, and that.
That's it. I got it. That time I found this is the doctor.
We are assigned a case, usually about 72 hours before the patient comes in. And what we do is that as a care coordinator, we will immediately initiate contact with the patient, whether it's by email or by phone, to let them know that we're going to be taking them to the appointments to see the doctors.
Besides the expertise they have, I think I would say they have a very good management as well. They have very good management, they coordinate so well to reduce the stress that the patients go through when they seek treatment. You know, obviously when you're in a state of anxiety to get treatment, in the state of sadness to go through all this, you know, we need the support from the hospital, from the managerial aspect of it, and besides the treatment aspect of it. And I got everything over here, and I was so happy that I was getting the best.
This is a job that is so exciting and so many amazing benefits, emotionally, psychologically, and also when we're able to help somebody during medical crisis and help them successfully, it just is very rewarding.
A few days after surgery, the Ali family meets with Dr. Jallow for Adam's post-op appointment, hoping for good news.
It's like everything we said on the email, right?
Yeah, everything worked out as we have planned. You know, in the schedule, the percentage.
Yeah, no, absolutely.
And you got a bonus now. It's percentage. Yes. Yeah. I don't know your doctor, yeah. You know what he said? He asked me to tell you he wants to be a doctor.
Oh, good.
He likes medicine a lot. He wants to be a doctor,
good.
just like you. Neurosurgeon.
When you're ready, let me know. Hopefully, we'll let you take over. I'll be ready to retire.
And that's, you know, to me, at the end of the day, when I go home, speak to my wife, my family, it's not the operation that I did. It's how I impacted a child that I feel more important in what I do in this world.